And here I'm going to introduce for Healthy and Happy Feet, Dr. Julie Johnson with Desert Orthopedic Center, and she will introduce herself and we'll get moving. Welcome, Dr. Johnson.
Thank you, Brett. Thank you for having me, and thank you for joining me in the audience today. And I am an orthopedic foot and ankle specialist, and as Brett said, I work here at Desert Orthopedic Center. And I picked this topic because I think that there's a lot of questions about our overall health and function of the feet. And I think the one common thing that happens is that as we live our life, we don't think much about our feet until they hurt. So I just want to give you some tools and some overall information to help prevent your feet from hurting and keep them healthy and happy. So I'm often asked by my patients, why do you want to take care of feet? And I find the foot and the ankle a very challenging and fascinating area of the body to take care of, because one of the most important things that I always say is that our ankles hold up our entire body, and our feet are really the foundation of how we move and walk. And there is always new and different problems that walk in my door. And no matter how out of alignment or how deformed the foot is, the body does its best to try to find a way to walk and keep us moving. And it's really just an integral part of our life. And I really enjoy taking care of all the complex and sometimes very simple problems to keep people active and to keep them in less pain. So one of the fun and interesting facts about the foot and ankle is that there are 26 bones and there are 33 joints in our foot and our ankle that work together to allow us to walk and run and play and move. And not only are the bony structures, important for walking and moving, but there's a complex soft tissue relationship between the bones, the joints, the ligaments, and ligaments span bone to bone, and tendons which span muscle to bone. And they really all work together. And the foot especially will always find a way to hit the ground and move. And when any of these are out of harmony or out of alignment, it is a very important factor in foot pain. So I mentioned in the previous slide, balance. This is probably the most important concept to understand why we start to have problems or difficulty with our feet. And the foot needs to have a balanced weight-bearing axis, meaning it needs to hit the ground in a balanced fashion in order to function properly. I just want to talk to you about what that means, and so you have a better understanding of how your foot works. So this scale is just an illustration of the concept I was bringing up in the prior slide, and that if one side of the scale is holding more pressure, then the other side has to give. And that's a very important thing to understand in the foot. And when one side is injured, the other side is going to do the work of walking, and that's going to potentially cause problems and pain. The image of a tripod is probably a very simple and visual and helpful tool in understanding the pressure points in the feet. The foot has 3 primary pressure points, and the 3 pressure points are the bottom of the heel, underneath the big toe, and underneath the small toe. And those 3 pressure points, ideally, when the foot is balanced and happy, are how our foot biomechanically works. Now, the 3 tripod model is very important when it ties into the arch. And questions about arches are one of the most common things that I address in my office. And I want to talk to you about the fact that there's two arches in the feet. We always think about the arch on the inside of our foot. And probably the most common question with arches are, quote, fallen arches or flat feet. But we also have an arch that goes across the top of our foot. And both of those bony arches are structured to allow us to take our next step. And another important and interesting thing that happens in the foot, it's very complicated, is that when our toe strikes the ground, the arch across the top of the foot becomes rigid. So we have enough shock absorption to place our heel down. And then when we lift our foot off of the ground, the arch in the back of the foot becomes less rigid, so you can swing your foot through and allow your toes to strike and hit the ground. So they both work in conjunction to allow our foot to function properly. And I'm going to go into a lot of kind of debate about flat feet, high arched feet. Are inserts helpful? And that's a very common topic that I get a lot of questions on. So I just wanted to touch on that a lot today. This is just an illustration of the two arches in our feet, and the arch on the inside of our foot, which we all think about, and then again, this arch across the top that I was just speaking to you guys about. So that's an important structural property that, if it's not functioning properly, causes pain. So there are three, very basic, and there's everything in between, but the three basic arches that we talk about in foot and ankle health are a normal arch. And normal is always kind of a tough one, because what is normal? But the alignment of the arch on this is a side, this would be like a side or a lateral x-ray. And the normal arch has a straight line from the talus, which is this ankle bone here, going down into the navicular, which is one bone down from the talus, and then into the cuneiform, and then into the metatarsal. It's a nice straight line. And on x-ray, throughout the years and through anatomy drawings, there's been lots of different angles that are drawn, but that's kind of the definition of a normal arch. And as you can see, the normal arch is analogous to the tripod that I spoke to you guys about, because the heel, the first metatarsal, and you can't really see the fifth metatarsal in this cartoon, but the fifth metatarsal would be the third point of the tripod. Now, one thing that I want to point out, and I want you guys to think about moving forward, is that in an ideal biomechanical model, again, where the foot is balanced, the arch does not hit the ground. Okay, the arch is not part of our tripod. And that's important. That's an important thing that I'll continue to touch on, but I just want you to start thinking about that. This is a cartoon drawing in the middle of my slide of a high arch. Now, a high arch, you can see that there isn't a straight line from the talus down to the metatarsal, but it would be kind of an uphill and then a downhill. And a high arch is still in effect a tripod, but the tripod has a little bit steeper angle in the middle, and that can cause some problems as well. And then there's the flat arch here. And the flat arch, again, if we think about the tripod, the arch shouldn't hit the ground. But patients who have a flat arch in more severe or more progressive flat foot deformity, the arch hits the ground. And if the arch hits the ground, the foot loses its tripod effect, and then the pressure points are not distributed evenly. So that concept will continue, and I will talk to you about the big debate of arch supports. Do they help or do they hurt your feet? So I just want to kind of touch on a couple of other biomechanical, or how our pressure points are allowed, and the function of the foot. So a arch that's too high, excuse me, which would be the middle drawing here, where remember it's not a nice straight line, the line goes up and then downhill, is called a cavus foot. And the most common term that you'll see out in the shoe world, as far as buying running shoes, walking shoes, etc., is that a cavus or high arched foot is called a supinator. That's one of the keywords you want to look for. And that has to do with the fact that in a high arched foot, the tripod is a little bit off balance and that it's tipped towards the outside of the foot and ankle. So there's more pressure on the outer border of the foot in a patient who has a high arched foot. And the cavus foot or the high arched foot, if their patients experience a lot of pain on the outside of their ankle, oftentimes what we're trying to do with an orthotic or an insert is to tip the outer border of the foot more even so the foot achieves balance. And common non-surgical and effective treatments for pain, and patients with a high arch often have pain on the outside of the ankle. They can also have a lot of pain through the heel where the Achilles inserts, and on the bottom of the foot where the plantar fascia is stretching. We oftentimes will use certain inserts that will tip the foot in to allow it to be more balanced, and physical therapy. And also one of the most important things with physical therapy and stretching and simple things like shoe wear changes that can really help keep feet healthy is that if you experience foot pain, you want to be more cognizant of the types of shoes, particularly running shoes or walking shoes, cross-training shoes. You want to change them more frequently than you did in the past, because a new shoe has more shock absorption, which makes the foot not work as hard to achieve the goal of walking. So that's just one easy tip to think of. And the other offender in the world of arches is the arch that is too low. And the arch that is too low is called a flat foot, or another common term that you'll see with flat arches is a pronator. Now, a pronator tends to have if we go back, if you remember, the pronator has an arch that touches the ground on the inside, the longitudinal arch. So they get pain on the opposite side of a high arched patient, and they get pain on the inside of the ankle and through the inside of the arch. And one of the most common tendons that becomes diseased or not working properly on the inside of the ankle is the posterior tib tendon. And that is the tendon that helps hold up the arch. And it often gets inflamed because it's telling us that, it's overworked and it can no longer do the job of trying to hold up the arch. Another very common foot problem that walks in my office are bunions. And the reason that I wanted to talk to you today about bunions is not only for surgical solutions, but I wanted to offer you some other tips that can help keep bunions healthy so you never have to go to the operating room. And the before and after picture on this slide, of course, is a surgical bunionectomy. And this also just helps me explain to you really what a bunion is. A bunion is actually a very complex deformity. And when you look down at your bunion, like we do in this picture here, everybody is drawn to this bump, which is very natural. It's very visible. You see it, and everybody, not everybody, I should say, but most people, and it's a logical conclusion, is that this bump is the problem. But what is important to understand about bunions is they are much more than a bump, and the formation of bunions is often tied to genetic or inheritable factors. A lot of bunions run in people's families. And also, the bunion can form when the arch or the longitudinal arch on the inside of the foot is not it basically in a flat-footed person, when the arch is falling, the forces that move the toe up and down are transferred laterally. Now, not everybody who has a bunion has a flat foot. Bunions can come with all types of feet, and that's more of a genetic predisposition. But it's a complicated thing that is way, there's way more that meets the eye than just this bump. And that is one of the reasons that sometimes after surgery, patients can have other problems in their feet because the bunion was a symptom of arch collapse and other types of things. And patients always ask me, when should I fix my bunion? When should I have surgery? In my mind, there's really two reasons that you have bunion surgery. Many people with bunions never have to go to the operating room, but I always say that the bunion or the big toe is the bully in the foot. And what I mean by that is that as the big toe moves towards the outside of the foot, it starts to run into the second toe, the third toe. And why it's the bully is that, again, go back to that analogy of the tripod, that the big toe is one of the significant pressure points in the foot. And as it moves towards the outside of the foot, it's going to push the other toes out of the way. And as it pushes the other toes out of the way, they become deformed. And then you may develop something called a hammer toe, which is where the first joint of the second, third, fourth, or fifth toes, but most commonly the second and the third, because they're right by the bunion or the bully, become bent and stiff. So that is one reason to consider bunion surgery. And it's kind of an interesting thing, and I don't think we fully understand why, is that some people, even when their foot becomes very deformed, still don't have pain. And it's always very difficult as a surgeon and as a patient to say, how can you even talk to me about doing surgery when I don't have pain? And that's a very valid thing. And the biggest reason is that as the bunion deforms all of the toes, it becomes very difficult to have a reliable, reproducible, successful result with surgery. So some people with more severe bunions, even though they're not in pain, consider surgery to help prevent a lot of problems down the road. And the second reason, of course, is pain. The visible bump that you see with the naked eye oftentimes rubs in shoes and hurts with activity, and pain is the driving force or the other reason to do bunion surgery. And again, back to the more complex deformity that causes the bunion is that when you do bunion surgery, if you just shave that bump off, the bunion's going to return. And you have to cut and realign the bones to reestablish a straight toe. Now I'm going to go on to heel pain. And all of these topics are huge. And I know I'm giving you a ton of information, but I just wanted to give a big overview of the foot. So heel pain is a very common affliction, and 25%, up to 25% of patients in the US alone at some point have heel pain. And a lot of the factors that I've already touched on are the reason why that occurs. But if you think about your heel, any problems with the heel are tied to the Achilles tendon. The Achilles tendon is primarily made up of 3 strong muscles in our calf. They form the tendon, and then the tendon attaches to the entire back of the heel. It has a very large surface area of attachment, and any site where a tendon, which comes with a muscle, tendon, bone, any site where a tendon attaches to a bone because of the mechanism of the muscle, and in the case of the Achilles, the mechanism of the muscle is plantar flexion, or pushing the foot down, and propulsion, pulling, which is basically propelling our foot off the ground, pulling our heel up, and striking the ground with the toes. So every step we take, that tendon is contracting and pulling, and it is a common site of inflammation. Now, a lot of people just come in and walk in my door and they say, I woke up to, 3 weeks ago and my heel hurt. I didn't fall. I didn't increase my activities. I didn't start running or playing tennis or pickleball. I just woke up and I have this pain. How is that possible? And it's very common. I don't think we fully understand what flips the switch. And one day you wake up and you have pain. It's a kind of an overuse type of syndrome that happens, daily repetitive walking, etc. And there's two main sources or main areas in the heel that hurts. A lot of people will get pain in the back of the heel where the Achilles tendon attaches. And then the second most common spot that starts to develop pain is on the inside of the heel, on the bottom of the foot. And the culprit or the structure that is causing the pain on the inside of the heel is the plantar fascia. And this slide just has a couple of other less common causes of heel pain. Sometimes when our Achilles tendon is inflamed and irritated, we don't walk completely balanced or normal. So the body is compensating and striking the ground differently on the heel. And this increased pressure on the bottom of the heel, which is where we walk, can develop into a stress fracture or a precursor to a stress fracture, which is basically where the bone internally weakens and can break. And another less common cause of heel pain is heel pad atrophy. What heel pad atrophy is that unfortunately for no reason, it tends to increase with age, we lose the thickness of our heel pad. We have no padding there, and we're literally walking on the bottom of our bone. So those are a couple of other things that can cause heel pain, but by far the most common is plantar fasciitis and insertional Achilles tendon inflammation. And this is just a cartoon schematic of the plantar fascia. And I think it's a really good visual because most of the time, and not always, patients experience pain right where the plantar fascia attaches to the bone. And the plantar fascia is a ligament because it goes bone to bone. But if you see here, it goes through the entire bottom of our foot. It branches into 5 strands and it attaches underneath all of the toes. So it's a very important arch stabilizer. And it's not just this little ligament that touches the heel. It is dynamically moving and changing to hold up our arch as we walk. And it attaches, and you can get pain anywhere. Some people have pain in the middle. Some people have pain underneath their toes. And some people have pain in the most classic description, right at the inside of the heel, where the ligament originates from the bottom of the calcaneus. The stress fracture that I mentioned is, again, kind of a less common thing, but it's an overuse syndrome. And in a stress fracture, the bone is not out of alignment, meaning that the bone is not fractured in several pieces. The overall structure of the bone is normal. It's just this internally weakening of basically the architecture, the bone structure that causes the break. And that typically will heal with immobilization in a boot and rest. It very uncommonly will require any surgery. And the heel pad atrophy, again, is the loss of that thickness of that pad. And unfortunately, the only way to fix that is to wear padded shoes. It's not something that can be treated surgically. They've tried over the years. They've done fat injections into the heel and into the ball of the foot. The pad and the ball of the foot can also thin, but none of them have been effective, where the fat just gets resorbed and it doesn't really help the problem. And the classic stress fracture, and I know I'm not talking so much about the tibia, but one of the most common stress fractures that you'll hear about in runners or athletes is a fracture of the tibia. And again, this is just a really good picture of what a stress fracture really looks like. Again, the bone is not out of place, but there's this line or this break that happens internally, and the bone breaks from the inside out. The navicular bone. I wanted to show you this picture because the navicular bone is one bone down from the ankle, which is the primary ankle bone is the talus. This is a side view of the foot again in this cartoon. And the navicular bone is where the posterior tib tendon attaches. And the posterior tib tendon is one of those big offenders in painful flat feet. So I just wanted you to see that illustration as well. And the navicular is a vulnerable bone in the foot in that it inherently, in all of us, does not have as rich of a blood supply as some of the other bones in the feet. And a lack of blood supply can also predispose bones in our body to develop stress fractures. And this is one that is a kind of a good picture to illustrate some of the biomechanical problems that happen with bunions. So I know you're probably sick of hearing about the tripod, but the bunion, or the big toe here, here's that bump we classically look at. This is the X-ray depiction of what a bunion looks like. And as you can see, the bunion forces pull the phalanx, which is this bone here, towards the inside of the foot and cause a rotation of the metatarsal head. Now, when that happens, the body transfers that pressure point underneath the big toe or the tripod, and it transfers it over to the next bone available, which is the second metatarsal. And biomechanically, the second, third, fourth, and fifth metatarsals are just not as robust. They are not as strong as the first metatarsal. And so when the body does that, sometimes patients will develop stress fractures, and this white fluffy bone on the outside is healing of the stress fracture. So again, that just helps you understand some of the complexities of the biomechanics of the foot and what can happen over time due to bunions. And another thing that I commonly get asked about, see these two bones here underneath, well, they should be underneath the metatarsal head, and they kind of look like they're floating there in space. They're not really floating in space. Those two bones are called the sesamoids, and the sesamoid bones are underneath the first metatarsal head here. And as the bunion forces rotate the toe, they also rotate those little sesamoid bones. And the sesamoid bones are in this really complex muscular tendinous envelope underneath the toe. And they are important pressure points that can be inflamed, and they can even fracture from repetitive stress or pressure points. And it's just a good illustration of what those little bones are doing. So I know that was a lot of information, and I'm going to have you guys ask me as many questions as you would like, but I just want to stress the overall concept of keeping our feet healthy. And part of keeping our feet healthy is understanding how our feet work. And I know I touched on a lot of different types of arches, and if inserts really help. So I just wanted to complete that thought. There's a balance between giving the foot support through shoes and inserts, and a balance of strengthening the muscles in our feet. You know, it's always been kind of interesting to me that we always talk about strength training in pretty much every muscle group in our body, but we do not talk very much about strengthening the muscles in our feet. And our feet have several layers of muscles, you know, in the top and in the bottom. Particularly the bulk of the muscles in the feet are in the bottom on the plantar surface. But these muscles help our feet move, and they help our tendons move, and we don't strengthen them, and we strengthen every other muscle group in our body. And I think that's a huge factor in developing foot pain. So strengthening of the muscles in the arch, a couple of simple things to do, activities that help strengthen them, is one is just walking barefoot. Now, walking barefoot just makes the muscles work harder because there's no shoes on your feet, and they have to do the work of walking. Now, a lot of people say my feet hurt when I walk barefoot. So that, you know, if your feet significantly hurt when you're walking barefoot, it's a balance of walking barefoot some of the time to strengthen the muscles, and then wearing, you know, some sort of support in order to help with the pain. And other activities that help with strengthening the muscles in the feet: swimming, any type of swimming, and not just, doing the flutter kick with the freestyle, water aerobics, Pilates, yoga. Those are all really great activities to strengthen our foot musculature, and that helps keep our feet healthy. But if you have daily foot pain, sometimes your foot is telling you that, you know what, it needs a little help. And that's where the world of inserts comes in. And it's overwhelming. It's overwhelming to patients, I think, to think about what type of insert do I need. And I think there's a couple of factors that are important to understand about inserts. One is that they are typically very expensive, hundreds of dollars. Insurance covers them very poorly. So all those factors are really important to me when I'm guiding patients on and recommending certain products, because I think it's very difficult to think about buying a $600 insert, and they can easily run that. And then you have no idea if your foot is going to respond to it. And then you just spent $600. So I always start with the class of inserts that I call the running insert. And there are several types out there, and they're lighter weight. They run between $40 and $60. So it's not as much of a financial investment. And then I think you can experiment with them a little bit to see if your foot does respond. Do they make your foot happy? Or some people's feet hate them. And then if you're doing okay with the over-the-counter inserts, I just have you stick with it. There's some foot problems, and there's some really difficult and deformed feet that do respond well to custom inserts. But I think that there's a bit of a marketing scam in the retail world with inserts, and they're really expensive, and it's frustrating. People go out and spend all this money, and I think that it's just better to start with a very low cost type of insert. And again, to me, the whole concept of an insert is that it's just a shock absorber. That's all it's doing. And it's helping some to balance the foot, but that's the most important concept. I think there's a lot of false advertising out there that the insert's going to, change your foot. It's going to fix your bunion. It's not going to structurally fix anything. It will help put pressure in different areas, but I just think that there's a lot of marketing scam out there with inserts. And, finally, the concept of the arch. Again, the arch does not want to touch the ground, and the arch does not want a lot of padding and reinforcement pushing on it. A lot of inserts have a very high amount of padding along the arch. And again, you have to think about that. The arch doesn't want anything touching it. So that can be a huge source of pain all of in and of itself. So that's kind of a big blurb on inserts. And I'll please welcome any questions you have.